Hello and welcome to the HDRC session on evaluations. So I'm Dr. Anna Haste. So I'm a senior lecturer in psychology at Teesside University. I'm also a health psychologist by background. So I'm going to run through a few different in today's session. So what is an evaluation, certain types that you can do, some models that you can structure your evaluations around, and a short example of an evaluation that I was part of recently, just to give you some examples of what you could do in an evaluation setting. So what is an evaluation? So it's a way of determining whether an initiative, such as a service or an intervention, can potentially be impactful. So was it delivered as intended? And what are the outcomes of that? And I'll discuss a little bit more what you can actually measure as we go on as well. So we could measure outcomes, we could measure impact, we can measure processes, which I'm going to discuss as well. It can be really helpful because we need to know whether something has been successful or not before we start planning for the future. And from the information from an evaluation, we can start to plan and redesign if necessary. So it can really provide the opportunity for lessons to be learned and hopefully improved in the future as well. Obviously, as an organisation, if you're going to conduct an evaluation, it allows you to be transparent and have accountability for investment, but also for what those outcomes are in relation to has it had an impact to the population that you wanted it to. And it can sometimes give broader lessons as well about good practice that can be transferable to different organisations or different services or interventions as well. So it can help the wider kind of environment as well. So there are different types of evaluation. So most evaluations fall into one of three different categories. So outcome-based evaluations. So in relation to this, it would be that you are looking at specific outcomes of a service. So for example, if you're running a physical activity intervention or service, what outcomes would you most like to look at? Is it the moderate to vigorous exercise? Is it sedentary behaviour? And you would base success on the outcomes of them. Has there been a significant difference? Are the intervention group outperforming the control, for example? This is quite different to process-based, whereas this looks at more of the whys. It tends to sit in the qualitative camp, and again I've got a slide that goes into a little bit more detail on that, but it potentially looks at why the outcomes happen really. So what is the in-depth information, what are the either barriers or facilitators that have maybe led to the outcomes that you've identified. Impact-based is more around potentially how have you specifically impacted on that population. So you might want to do an outcome of physical activity, for example, but is the impact that actually it's reduced the amount of hospital appointments, or has it reduced the amount of readmissions or medication? So it's more generally and a little bit wider in terms of how is it specifically impacted on that population itself. So it might be a bit of a broader kind of concept. As I mentioned, there's different types. So in the third column, in the second and third column, sorry, you can see whether it falls under whether it's a process or an impact and an outcome. As you can see, most fall in outcomes and then impacts as well. Process evaluations tend to sit in the qualitative camp, as I've mentioned. So usually involve things like focus groups or in-depth interviews. Obviously, it will depend on the population you're working with. If you're working with a very vulnerable population, you're probably more likely to do in-depth interviews. Focus groups might be overwhelming, it might not be appropriate, it might be sensitive content. Other alternatives or examples, it might be more useful to look at focus groups so you can get a range of different stakeholders in a room and identify kind of their consensus in general. So it can really provide information on why intervention may or may not have worked. It's generally quite cheap to do, even cheaper now that we can do interviews on Teams online. So actually sometimes you don't even have to be in the same room as people. Transcription can normally be done automatically through things like Teams as well now. Potentially, one of the cons though is that you tend to choose the sample. It's obviously people that agree to take part in these as well. They're not necessarily as random as if you're going to go on to more the quantitative examples that I'm going to give. Results with qualitative research, we don't try and generalize findings, but obviously that can be quite difficult if that's something that's required for you for an evaluation. So quite often what you have in an evaluation is mixed methods. So you have a qualitative aspect and a quantitative aspect as well. And it's helpful because actually then you're looking at process impact and outcome, but also you're potentially looking at different data collection methods and allowing to see whether they align with each other. Do they agree against each other? Because if we only collect one, it potentially could show us quite positive, but actually that might be quite biased because of the collection tool that we've looked at. So it allows us to look at it in a broader concept and say, are we getting consistent findings in relation to this? Looking at the quantitative examples, so the most rigorous kind of gold standard example is a randomized control trial. They can be expensive. Normally what we see in smaller scale examples are pilot trials to start off with, though. You would still have an intervention and a control group, but the numbers are a lot smaller in relation to working out whether it's potentially viable and it's worth then investing in a randomized control trial. Randomization is obviously not always possible. We have situations where actually it's natural selection for either a service or an intervention, and then you might look at other alternatives like the controlled before and after, for example. You still have a control group, but potentially it might be more practical to actually implement than actually randomizing people to a certain avenue. Interrupted time series, so it can be practical if there's different number of events. So do you want to collect at 3, 6, 12 months, for example? That might be useful to look at kind of those time delays and whether things have an impact over a longer period of time. Before and after study, this is when there's no control group possible. Obviously, normally we would suggest that we try and get a control group, but it's not always possible. It can be cheaper for that reason. But again, that's why it reduces kind of the level of kind of vigorous evidence that we can say to support when we collect data in this manner. So all of this and more information is actually on the World Health Organization website as well, and the documents in relation to this. So I've touched a little bit on what an evaluation is and how we could start to do it, some of the pros and cons, which leads us to why we would want to evaluate in the first place. So it does give us a sense of direction. It allows us to ask questions in relation to things that I've mentioned already, how well an intervention, a practice or a policy is working. It allows us to demonstrate that we're using resources the most effective and efficient way. So actually, potentially, are there ways to improve? So it allows us to look at ways to improve services using the best evidence. It allows us to share achievements, no matter how small. So this is why it's potentially quite very useful to do process evaluations along the way, because they might bring on very nuanced, very niche aspects of an intervention or a service that we wouldn't know by just collecting quantitative data, for example. So it allows us to identify maybe what might seem quite small in the data set, but actually is really important to delivery. And it can obviously be helpful for other people as well. We can further the knowledge and the evidence base if we do evaluations as kind of common practice. So just to continue this, I think there's sometimes a question of, well, how does evaluation differ from research? And here are just a few different ways that Baker kind of set out in relation to it. So the main aim is to assist decision making. So it's meant to inform commissioning of a service, for example, or an intervention, rather than add to the knowledge base, which is the purpose of research, is that you input into the evidence base that exists already. It can often be done on behalf of a decision maker, often a manager or commissioner, for example, who may be distinct from the evaluator. Research often quite tends to feed back into somebody that's doing it in an academic setting, for example, whereas this could be quite different. It quite often takes place in a naturalistic setting rather than a lot of research, and that's not all research. Actually, a lot of research can take place in a naturalistic setting now, but actually more formally, if we think about academic research, we try to do this in a more controlled way. So if we were setting up a research project, we would probably try and structure it in a way that we could try and do randomized controlled trials, for example. Whereas when we're doing evaluations in real services or real interventions, we often have to use the structure that exists already. It's normally intended for immediate use, and it's normally done over a lot speedier time frame than some research is as well, because it's normally used to inform things like recommissioning. A service might be ending and they need evidence to show that it's been impactful and why it's worth investing in it in the future. It's often only written up for local consumption, so it might be fed back to the local authority or the local trust, for example, rather than if you were doing a research project, your aim primarily would be an academic journal. I'm going to show you, the example that I'm going to show you is it crosses over these two things, so hopefully it shows you that you can actually move outside of these parameters as well. So in terms of evaluations, quite often, and what I've worked on a lot, is service evaluations, and what this involves is a rigorous review of a current provision. So again, like I mentioned, this might be a certain pathway, a certain full service, a certain intervention. And we normally appraise it as to how well is that service performing against its aims and objectives. So against things like service specifications. So for example, I've worked on a project before where we had 4 different companies, providers for the service, and we looked at all of their service specifications against what actually was being done. And we were able to identify how well they were doing against each other. So it's normally designed around the context of establishing how effective the service is. It examines the wider impact, so both what is intended and what's unintended, and that can sometimes be as informative, what is the unintended consequences, as sometimes what you're intending to change as well. And I think that's something that's really important if you're thinking of then maybe rolling this out further to more people, more trusts, more local authorities, for example. Same as you would with research, really. So it quite often asks the questions that are quite broad questions in relation to this. Have you achieved your goals? Have work practices changed? How long has it taken to achieve the desired change? And have the improvements been caused by the changes? And again, it will depend on what you want out of your evaluation as to whether you look at all of those things or whether you choose specific questions that are important to you at that time and stage. So it's to make sure that the resources, the time and the energy invested in the improvement work represents a value for money. So it shows whether change was an improvement or not. So by putting this service in place, has it led to an improvement? Has it been worth that improvement? It shows to the extent of which can be sustained. Obviously, that will depend on how much data you've got and how long the service has been implemented for. It can show similarities and differences between initiatives, so we can learn and develop general principles. So, for example, there's been evaluations that have been conducted against a variety of different cancer services, for example, and it's allowed them to identify that there are similarities across different pathways that they can learn from, things like information provision. But actually, within different pathways, certain cancers need certain different aspects embedded within them because the patients require different expectations to satisfy the needs along the way. So although sometimes similarities can happen, it's really useful to identify what those differences are so that we meet expectations and satisfaction levels within patients or participants. So I've kind of outlined this before, but just to sum it up in a little bit more detail, there is research that addresses a well-defined question. It tries to look at generating new knowledge. Evaluations are looking at whether a service is actually meeting its aims and objectives, and also whether potentially it is performing as intended. Audits are slightly different from that because they measure a certain aspect of practice against a recognised standard. So it's specifically looking at whether it potentially embeds it to the best practice standards that are acknowledged and recognised. So I've already suggested some questions, but these are a little bit more, I suppose, specific in terms of useful questions that can be asked during an evaluation. And like I said before, it might not be that you ask all of these questions. Again, it's very much as what is important to you. What do you want to get out of the evaluation? And I'll talk about that in the challenges. That I think it's really important to maybe at least go through these lists of questions at the start, so that whoever is doing the evaluation and whoever is actually requiring the evaluation, that their expectations are the same, or their kind of what they want out of the project are the same, so that they line up and the deliverables are satisfactory to both sides. So just a few examples. Is everyone clear what the aims and objectives of the evaluation are? Who are the key stakeholders, and has the team made contact with them? What will be the role of patients and public within this? What are the best methods to collect the data required to answer the questions? So are they collecting data already? Are they not? This will widen the scope as to how long it takes for the first statement, but also if they're already collecting data on it, it's kind of, you're probably going to use that data. It's good practice to kind of use what's been collected in relation to them, but it's also worth assessing whether that data will answer the question they want out of it. So there might be data collected already, but actually, will it answer the question that you want at this present time? And that's worth discussing through to make sure, because if you get a data set and it isn't the right thing to answer the question, it's then a lot of back and forward once the project's taken place. If there's no data collected currently, that's another full conversation as to what will be the best approach, what actually will be feasible, who will collect it, the evaluation team or the actual service team. And again, that has implications on things like time, cost and ethics. Is the proposal achievable in the timescale? So again, I've worked on projects where we have had things like they wanted an interim report. Actually, then the time frame got shortened. So we decided that actually, if that was the case, we then needed more time to collect the data. So the interim report got pulled and we just provided a full one at the end. So I think it's about open communication in relation to that. Again, leading to things like expectations and satisfaction. What's achievable in the budget? And I'll talk about kind of how you do it in various ways later on. Are necessary approvals in place before starting this evaluation? So things like ethical approval are things that potentially can add to timeframes and cost, because they do take some time to put through. So does it need university ethics? Does it need NHS ethics? And that all needs deciding because it will impact on the time frame and what you can get out of the project as well. Is it clear how you access the information, the data required? So again, like I've mentioned, it depends what's being collected, where is it being collected, who do you have to get permission off to get that data? Can somebody outside of the organisation get access to that data? Is it a case that it just needs to be anonymised? That's fine, but also there still is time implications on anonymised data. So I've had, again, this on previous projects where we waited a substantial time before data was anonymised, before we could receive it, and that did have an impact on how long we had then to analyse the data. Are there any gatekeepers? And again, I think this is a really important one, someone who can facilitate the access to the evaluation site or data. Are they able to recruit participants if needed? So things like your focus groups or your interviews, do you actually have somebody that is able to facilitate that? And again, that will impact on the timeline that you have. Are contingencies in place if things don't go according to plan? So does nobody agree to take part in an interview? What is your backup plan for that? What is the idea in relation to that? And again, I think that's why it's important to identify whether you have gatekeepers to try and make the methods that you want to collect the most feasible to actually implement. So I've touched on one of the previous questions on the last slide was how are we going to involve patients and public? So again, this is a major important aspect. So patient and public involvement and engagement, sorry, there should be an E on the end there. Obviously, to try and do this as early as possible is really important. But again, it does rely on things like having a budget, which I appreciate isn't always possible in relation to every service or intervention that's implemented. What do you want to involve patients and members of the public for? We are expected to, it's good practice, but it's really worth thinking through clearly why they would be beneficial. They allow their lived experience to be involved in the evaluation. So are you looking to involve them at all parts of the project, from the maybe the initial decisions of what the aims and objectives are, right through to disseminations of findings, or are they going to be in more an advisory capacity? And again, this will involve more conversations around what is your budget, because you are expected to pay people to do this now. There's NIHR guidelines on this, but also what is their capacity? What might they actually be able to do as a stakeholder group? So there is some more advice on this, if this was something that you had more kind of queries in relation to, on the Involve website that has a lot of documentation that's really helpful on this topic. So who should carry it out? And again, I think it really will depend on things like your budget and your timeline, basically, and what you want to get out of the project. So you could commission it to an external team. So similar to like us at Teesside University, we quite often get organisations come to us and say, can you evaluate this? We're an external team. There's obviously an advantage to that. We are trained in research methods. We regularly do evaluations. We use numerous different data collection methods, such as qualitative and quantitative research methods. It also allows us to have objectivity, and therefore could be seen as more credible because it's not somebody who works along in the organisation. We don't have a vested interest in this intervention or service being successful. We may have different perspectives and unexpected insights that potentially, as an outsider who isn't invested in the kind of service and outcomes, might bring different perspectives that haven't been thought through before. There are, of course, disadvantages, though. It can often be expensive to resource an external evaluation. It might take them some time to familiarise themselves, especially if it's services that cross things like local authority and the NHS. Where do teams sit? What services are embedded within them? What are kind of the key stakeholders in relation to that? What jobs and what patients do they see? And I think, again, that's very much about setting up communications at the start. And I know I've worked on evaluations where they've sent me documentation of what the service outlined were, and it's so helpful to then get a grip before you then meet with those people so you feel better. You could commission an external evaluator to work with an in-house team, so it might be a combination. It can sometimes be less expensive than just doing it fully externally. Again, they might have a better context and understanding of how the systems work. It might be easier to capture the data with a joint approach. However, there are some disadvantages like before. Again, it can be quite time consuming because it sometimes might feel like there's lots of back and forth between the external and the internal because it's two kind of bodies working on the same thing. It needs a lot of collaboration, a lot of communication. Again, it brings into kind of question whether it's fully objective then if the internal team are involved, and it's normally about being transparent in that and stating that actually this is somebody's role when you're presenting findings in relation to it. And it might be about actually how do we match up people's skill sets then? Is it that they work together to assign which jobs or roles might be better equipped for the internal and the external person? Or you could do it fully in-house. The in-house evaluation would obviously encourage maximum involvement and participation from the in-house team. It has the scopes to develop new skills in the staff. It might be something that they've not done before. It actually hopefully might be cheaper and quicker. It might be that you could potentially look at building in findings to the project design as they emerge. So actually, can you learn as you kind of implement changes? Which again, you would have to be clear and document how you did that though, still to be transparent. And it could mean that ongoing collection of data to monitor the improvement is more likely because potentially they sit within the database that's being used, they have access to the data a lot quicker. The disadvantage is whether people are actually given time to do this, though. Is it an add-on to the job? So it needs a dedicated project lead still. It needs somebody with good project management and research skills. Again, like I mentioned, they need to have spare capacity to actually do it and the technical resources to analyse the data. Again, there's potential problems with objectivity, and that needs to be addressed in order to allow the evaluation to have credibility. And there is a greater risk that the project lead will be diverted by other priorities in their everyday job in relation to that, unlike an external, which probably would get costed out. So how to make a decision? So it can be tricky. I think probably it will be on a number of different factors as to which route you would go. I think it would be in relation to a number of different factors, but how much objectivity do you want in relation to it? If actually you need really strong evidence that potentially supports the service, is it worth investing in the external so that you can provide that to hopefully get recommissioned? What resources do you actually have? What budget? What time do you have? Do you actually would you prefer for somebody in-house to do it, but there is nobody to do it? That might make your decision for you. Or do you have no budget to do it and that makes it your decision for you so that you have to do it in-house? So it really will depend on kind of these questions on this page. How complex is the work that you're looking at? How complex is the data? How complex is the data analysis that you want to do? Do you need a special expertise to actually do it? And again, all these questions will hopefully help clarify what is the best option for yourselves. So just to kind of reflect on some recognised evaluation models that exist, there are numerous. There's always decisions to be made in relation to which one you want to look at. But these are just some examples that could potentially provide a framework for you when you're thinking about doing an evaluation. These will differ with what type of evaluation is in focus. So you want to pick the model that fits the type of evaluation that you're doing. So the first example is logic models. So these are used a lot. So the MRC framework on developing and evaluating complex interventions outlines this in a lot more detail. But this is quite often used in government and not-for-profit organisations. but it's designed to be very linear in terms of the manner of how we look at it. So it looks at what are the resources, what are the inputs, what are the activities that we do, what are the outputs. The outputs can be made broader than this, so you can do short, medium and long-term outputs to identify actually what would be our expectations at 6 months. This might be when the evaluation's taken part, but actually we hope for this at 12 months. And the impact as well. So it looks at both our outcomes and impacts as well, which is a nice way of doing it. So as I mentioned, the MRC framework is really helpful in terms of addressing this in a lot more detail. Another example is a context input process product model, or the SIP model by Stufflebeam back in the 60s. So this looks at the context, what should we do, the inputs, so how should we do it, the process evaluation, are we doing it as planned, and the product evaluation, did it work? And there's a number of different factors that you can look at in relation to that. I won't go through them all, but it's just a screenshot so that hopefully it gives you an idea of the sort of things that you could look in each of those different coloured sections in relation to it. And a few of the things I've mentioned already, things like your stakeholders, your budget, things like how do we monitor, how do we feedback, things like the impact, effectiveness, how sustainable it is an important aspect as well. Another example is the model of service evaluation. So this was back in the 80s. And this looked at kind of 3 different aspects, and I've touched on them slightly already. Some models have overlap in relation to the things that you can look at, and I think it's sometimes what you think best relates to your evaluation that you want to do. So the structure, the physical resources, so what buildings are needed, what staff, what equipment, what facilities, so a lot around the practical kind of implications of the service or evaluation. Process, how is the service being delivered, how things are organised, how referrals work, what kind of clients, what kinds of therapy or service or intervention, how do people communicate. So again, looking a little bit into the how, but also the why, potentially, of why it might work. And as I've already mentioned, the outcome, the impact of the service on clients and the community. So do the clients benefit from the service, which is the overall kind of query that everyone's asking in relation to it. So just to give you a really brief example of an evaluation recently, and it was looking at a local authority's mental health support teams. So mental health support teams are teams that are primarily made up of a range of different professions, lots of mental health support workers, and potentially they have 3 core functions. So they're embedded within schools to deliver interventions, and this can be on either a group basis, so it might take full classes and do interventions with it, or it might be on a one-to-one. It might work with a particular student based on what is appropriate for the individual. So it has 3 core functions to deliver evidence-based interventions for mild to moderate mental health issues. And this is where it moves it away from what CAMHS deliver, which are more the severe end of mental health issues. The aim of the mental health support teams is to try and look at children, hopefully that then reduces the amount of referrals to CAMHS and also helps to stop problems from heightening and getting worse and leading to a referral to CAMHS. So it wants to deliver evidence-based interventions for mild to moderate mental health issues. The second is support the senior mental health lead. So there should be a senior mental health lead in every school, primary and secondary. So in each school or college, to introduce what they class a whole school or college approach. So again, it was about thinking about not necessarily just doing that traditional one-to-one kind of setup, but how can we embed it as a full school or college? So talking about things like group interventions, for example. Give timely advice to school and college staff, and liaise with external specialist services to help children and young people get the right support and stay in education. So it might be that potentially they actually liaise with some external specialists like advisory teachers or psychologists, but then it's still trying to keep it in-house. So this was an evaluation that was funded by the NHS and local authority. The aim of the evaluation was to evaluate an initiative that provides mental health support in local education settings in the Durham local authority, which was 3 different areas. There was a number of different objectives. We wanted to evaluate the project against the 3 core functions that I mentioned, that I've outlined. We worked collaboratively to develop the research proposal or protocol to ensure that their expectations and what they wanted out of the project were met. We quantitatively analysed relevant outcome measures and statutory returns. So there should have been improvements on certain aspects or outcomes, and we made sure that they were looked at in the analysis. We carried out qualitative interviews and focus groups with both staff in the participating schools, but also staff within the mental health support teams, to try and look at progress, but also barriers and facilitators to success. And we also carried out a rapid literature review of evidence on similar interventions that were taking place elsewhere, and other evaluations of other mental health support teams, because they're implemented kind of nationally. So within the protocol that we put together as kind of the external evaluation team and the actual people who would commission the evaluation, it was decided that this is the project that I mentioned. We decided that we were just going to do one final report. It initially started as an interim and a final report, but as you see, the timeline reduced. So it went from 12 months to 9 months, if not nearly 6 by the time we got things off the ground. So one final project was delivered at the end of the project. They still came back to us with some kind of recommendations or queries, and we were able to kind of input them and amend them and send them back with the final report within the time frame. One additional was actually, this wasn't a requirement of the project, but as an academic team, we actually got a peer review published paper in relation to this as well, and that's the reference underneath. So we published that as a team, and we're able to show the qualitative side of the project in relation to actually getting it out there in an academic journal. So what did we do? So we needed to look at a range of different aims and objectives. So like I mentioned earlier, we used a mixed method as this was the most appropriate to do. So we looked at NHS data. So again, there was back and forward with who was the gatekeeper to the data, how we were going to access it. It needed to be anonymised, and then we were able to then analyse it. So we needed to work that out in terms of a time frame so that everything went in order to enable that to happen. This looked at patient-reported outcome measures, clinician-reported outcome measures, consultation conversations, referral data, and whole school approach data. So this was data that was routinely collected already. So no new data had to be collected as this. We were using this as almost secondary data analysis for the evaluation. Interviews were conducted with school staff, like I mentioned. So we approached the senior mental health lead in each of the schools and invited them to take part in an interview, basically. Then we conducted focus groups with the mental health support team staff, and we actually were able to do this across every different type of title, role, job role, stakeholder, I suppose, to allow us to have a variation on experience. And I think it worked really well actually having that as a focus group so that everyone could discuss it in collaboration, because there were quite different roles within the team, but they were all embedded, and quite often different roles would see the same patient, and it was nice to actually hear different experiences as to how it aided or acted as a barrier that was the process. We also did a focus group with some children as well in relation to it as to how they'd found the experience of having these mental health support teams come into their school. So we interpreted the data to make an overall assessment of the service success within one area of England. So I think it's worth being transparent about that actually this is something that's rolled out nationally, and there might be variance. And I think it was one of the things that was highlighted in the report. We discussed the findings, so what are the possible reasons for those outcomes not changing significantly? If that was the case, what was the reasons for any of the successes in terms of outcomes? What were the strengths of the project and what were the drawbacks? And we actually created a list of recommendations to feed back to the service if this was to carry on and get recommissioned for future delivery. So I'm going to finally, I'm going to end on challenges, but I don't want to end on a negative. I think an evaluation is a very positive aspect. So these are just some of the challenges that I've come across, but I think it's not necessarily just a challenge, it's something to consider, I think is more probably the right terminology to use in relation to this. So I think it's really important to understand what the client or organisation's expectations are so that they align. We can see what we would maybe like to evaluate and what we would want to do with the data, but I think it really needs to be as to what is the best outcome for them, even down to the degree of how do they want it presented. Do they want it in a Word document as an official report? Do they want it as presentation so that they can provide it to commissioners? All of that is really beneficial, and it might be that you provide it in a variety of different forms, but again, does that impact on the timeline and the budget? So I think it's really important to have those expectations ironed out at the start. Communication. So again, the project that I gave you the example of, we fit in a 10-minute, 15-minute meeting every week just to go, right, what was the action from the last meeting? Has it been achieved? If not, this is getting more time sensitive. We need to push on it this week. So again, it was just because we were almost 3 different organisations that were working together, it was to make sure that the project stayed on task. Making sure you have all the information you need in order to be able to carry out the evaluation. So again, things like I was waiting on data access, so I needed it to be anonymized. So again, those regular meetings allowed me to kind of communicate that, and allowed the team, the organisation team, the client as such, to follow that up for me on my behalf. So I've mentioned managing expectations, and again, I think that's on both halves. I think sometimes it's being clear as to what the money buys you. So being clear about how many days that equates to. This will get you 7 days of my time to work on the project. How do you want me to do that over that time frame? Do we meet at this time? I'll work on this once a month. All of those pieces of information are really good so that kind of everyone understands what everyone's involvement is. Being flexible to accommodate additional requests within reason, I think, in terms of it, being able to work to tight deadlines. And like I said, I've worked on a few different evaluations where the time frame has been shortened, and it might be talking about what is then achievable, but I think it's good to have flexibility in terms of that. And I always think this is really important in terms of collaborating with professionals from multiple disciplines so that you get all angles of the service. Every stakeholder should be involved in the conversation, and be part of the kind of process. It's helpful in terms of what you want to evaluate, but it's also to give a full holistic view of the evaluation and the service in question. So I think these are things that may be challenging, but I think if you actually approach them head on, they can be really positive, so that expectations are matched and that hopefully there is satisfaction from all sides at the end of the project. Thank you for listening.